Hello future doctors. Today we are going to discuss about the drugs for erectile dysfunction. Erectile dysfunction is the inability of the men to attain and maintain penile erection. If you see, this is more common among the individuals who are above 65 years of age. The causes may be different. It may be psychogenic or hormonal or vascular, or it can be neurogenic. Let's now see the mechanism. See, if there is a sexual arousal, there is parasympathetic stimulation. From that, there are certain nerve fibers which are known as non-adrenergic, non-cholinergic nerve fibers. They will be stimulated, and due to this parasympathetic stimulation there is release of acetylcholine also. Now this nerve endings will release nitric oxide from, in neurons there is neuronal nitric oxide synthase, NOS, which will produce nitric oxide. So from here there is production of nitric oxide, and if you see, this acetylcholine will act on endothelial cells. We know the endothelium has M3 receptors, vascular endothelium having M3 receptors. On that, acetylcholine will act. M3 receptors are GQ coupled. If it is GQ coupled, there will be increased calcium levels. This increased calcium will bind to calmodulin to form calmodulin complex. This calcium calmodulin complex will now activate endothelial nitric oxide synthase. Due to the activation of endothelial nitric oxide synthase, it will convert L-arginine into nitric oxide. So from neurons there is nitric oxide synthase, and from endothelium also there is nitric oxide synthase. Now these nitric oxides will act on smooth muscle cells. It may be vascular smooth muscle cell, and also on the corpus cavernosum. This nitric oxide will enter the smooth muscle cell, and they will activate soluble guanyl cyclase. Due to the activation of soluble guanyl cyclase, there is conversion of GTP into cyclic GMP. The cyclic GMP can be converted into 5-GMP by phosphodiesterase 5. The cyclic GMP will lead to the formation of protein kinase G. We know that the protein kinase G will activate myosin light chain phosphatase enzyme. Myosin light chain phosphatase. This myosin light chain phosphatase will dephosphorylate the myosin light chain. If there is a myosin light chain which is in phosphorylated form, we know that myosin light chain should be phosphorylated for contraction. Now this myosin light chain which is in phosphorylated form is dephosphorylated by this myosin light chain phosphatase. Now due to this there is relaxation. Now because of this relaxation, the corpus cavernosum relaxes and the blood vessels also relaxes, increasing the blood flow to the corpus cavernosum sinuses. There is penile erection, and also if you see, because of this increased blood flow to this penis, there is compression of the veins against the tunica albuginea, which will decrease the blood outflow. Now let's see the same thing. Smooth muscle in the corpus cavernosum and blood vessels are relaxed, so it will increase the blood flow to the sinuses of cavernosa, and there is compression of veins against tunica albuginea. If you see the causes for erectile dysfunction, hypogonadism is a very rare cause. If there is erectile dysfunction due to hypogonadism, the drugs which we can use are androgens, especially the parenteral testosterone esters and transdermal testosterone therapy. The main first-line drugs for erectile dysfunction are phosphodiesterase 5 inhibitors. Why? You can see in this diagram, if we inhibit this phosphodiesterase 5, there is increased cyclic GMP, which will increase protein kinase G, and there is further increase in myosin light chain phosphatase, which will dephosphorylate myosin light chain phosphatase in phosphorylated form. It will be dephosphorylated. This will lead to the relaxation and it will lead to penile erection. So that's why phosphodiesterase 5 inhibitors are used. There are three phosphodiesterase 5 inhibitors, which are sildenafil and tadalafil and vardenafil. These three drugs will inhibit phosphodiesterase 5. First we will see about sildenafil. Sildenafil is orally active. If you see, the penile terminescence is improved. Like terminescence means the quality of swelling. But this effect cannot be seen in the absence of sexual activity. There is no priapism. Priapism means the prolonged penile erection. It can be like around 4 hours, more than 4 hours. We can say it is priapism. When there is more than 4 hours of erection, then we can say it is priapism. Sildenafil is metabolized by CYP3A4. It is ineffective in men who have lost libido and causes neurogeny. See here, if there is neurogenic cause, then the nitric oxide will not be produced from the neurons, and there is neurogenic cause, then acetylcholine will also not be produced. When there is no nitric oxide production, there will be no smooth muscle cell relaxation. So if we are inhibiting phosphodiesterase 5, if we are giving sildenafil, then there is no use, because there is no production of cyclic GMP itself. So then there is no use of phosphodiesterase 5, which will inhibit, there is no use of sildenafil which will inhibit phosphodiesterase 5 if there is, you have a neurogenic problem. Let's come to adverse effects. In adverse effects, the main adverse effects are due to the vasodilation, which are headache, flushing, dizziness, nasal congestion and fall in BP and loose stools. If you see, it will also relax lower esophageal sphincter, which can lead to gastric reflux and dyspepsia. It will also weakly inhibit phosphodiesterase 6, which is involved in the phototransduction in retina. There is impairment of vision also, color vision. So there is blue-green discrimination cannot be done. In some patients, they have seen that there is sudden loss of vision due to non-arthritic ischemic optic neuropathy. It should not be used along with nitrates, because we know that nitrates can dilate the vessels, and sildenafil also dilates the vessels. So there will be precipitous fall in BP. So it is contraindicated with nitrates. Some other contraindications of sildenafil are coronary heart disease and those taking nitrates, the same I told, and peptic ulcer and bleeding disorders. In patients who have leukemia, sickle cell anemia and myeloma, they have a chance to develop priapism. So in them, there should be caution before giving sildenafil. Pulmonary arterial hypertension. In pulmonary arterial hypertension, phosphodiesterase 5 inhibitors can decrease pulmonary arterial pressure. Sildenafil has more selectivity for the pulmonary circulation. Let's come to tadalafil. Tadalafil is more potent and longer acting. Adverse effects are similar to the sildenafil, but one thing you have to notice, it can additionally cause back pain. Vardenafil, it is also same like sildenafil, but it prolongs QT interval. So it is prolonging QT interval. You cannot use in patients who have long QT syndrome and also with class 1A and class 1A and class 3 antiarrhythmic drugs. Let's come to another one drug, which is alprostadil, which is PGE1, prostaglandin E1. It is directly injected into corpus cavernosum, which can cause smooth muscle cell relaxation. See, come to this diagram again. there is expression of EP2 receptors on these smooth muscle cells on which prostaglandin E1 will act. These EP2 receptors are GS coupled receptors, so they will increase protein kinase A. If protein kinase A is increased, they will convert myosin light chain kinase into myosin light chain kinase phosphorylated form. This phosphorylated form is inactive. See, myosin light chain, when it is phosphorylated, it is active, but myosin light chain kinase, when it is phosphorylated, it is inactive. So it will lead to the relaxation. So alprostadil can be used, which is directly injected into the corpus cavernosum. It is less painful. Let's come to another drug. There is papaverine, which is when we are injecting, it is painful, but alprostadil is less painful on injection and it can cause local tenderness. Penile fibrosis and priapism are rare. It is used in cases of when there is no response with phosphodiesterase 5, or in cases like you can see phosphodiesterase 5 cannot be used in neurogenic and psychogenic erectile dysfunction. So at that cases we can use alprostadil. There is a transurethral pellet through which alprostadil can be given instead of injecting directly into the corpus cavernosum. It is known as medicated urethral system for erection, but it is less effective and it is said to it can cause urethral burning, so it is not used. Papaverine or phentolamine induce penile erection. If you see, when papaverine with phentolamine or without phentolamine, when we are injecting it into corpus cavernosum, it will produce penile tumescence. Priapism can occur with it, but it can be reversed by we are aspirating the blood from the corpus cavernosum. It can be reversed, or we can inject phenylephrine, which will constrict the blood vessels. Complications. The complications are like local hematoma, infection, penile deviation, paresthesia and penile fibrosis. It is used rarely, like when we are giving phosphodiesterase 5 inhibitors, they are not useful, and after giving alprostadil also there is no effect. At last we are going to use this papaverine or phentolamine induced penile erection therapy. Thank you.